Namaste. Welcome.
Thank you.
Namaskar. Greetings from HCFI. मैं कृष्ण चावला आपका दोस्त और आज के इस 110th 110वें नॉन स्टॉप सेशन का होस्ट सभी देखने सुनने वालों के साथ साथ RWAs, मार्केट एसोसिएशन, NGOs, टेक्सटाइल मार्केट एसोसिएशन और हेल्थ एजुकेटर की एक्सटेंडेड फैमिली का आज के इस 110th सेशन में स्वागत करता हूं। हर तरह की हर वेडनेसडे की तरह आज भी हमारा सेशन 2 भागों में रहेगा। पहला भाग डॉक्टर कालरा लेंगे और दूसरा भाग डॉक्टर श्रुति खरबंदा लेंगे। इससे पहले कि मैं सेकंड स्पीकर को इनवाइट करूं और इंट्रोड्यूस करूं, मैं अपने मेंटर डॉक्टर के कालरा को इनवाइट कर रहा हूं कि आज ब्रीफली आज के कोविड की स्थिति में अपडेट दें। डॉक्टर कालरा, ओवर टू यू एंड नमस्ते, वेलकम टू द सेशन।
Thank you, Chawla ji. I welcome Dr. Shruti Kharbanda.
Thank you so much.
Under 10th session started by Dr. K.K. Agarwal under Heart Care Foundation of India. I
Thank
also
you.
welcome all the other participants who are present and attending the session. And to brief you about the COVID situation globally and in India, let me share my slide. It's visible to all.
Yes, we can see.
So COVID-19, globally, we can see even on 21st of this month also, today, new cases reported are almost 8.5 lakhs all over the world. And 7-day average is almost around 5.6 lakhs. If we see the various WHO regions, this is a last Wednesday report because the new report the release on Thursday. So I always have to show the previous week report, which compares with the further prior week. So during this week, ending on 15th of June, America's region of WHO has shown 13% increase. And Eastern Mediterranean has shown 58% increase in new cases, and Southeast Asia, 33% increase in new cases. Rest of the region, they have shown decline. And overall, if you see in all the 6 regions, overall there is only 1% decline in new cases of COVID-19 seen as compared to the previous week. And deaths, there was an increase globally, there was an increase in almost 4% increase in deaths all over the world. In India, if we see as per Ministry of Health report, the last 24 hours, 12,249 cases has been reported and 13 deaths. Recovery rate is almost 98.6% and death remains at 1.21%. Overall, if we see the total vaccine LG government guidelines, almost 196.4 crores doses have been administered. Even 7-day average in India is as reported 12,000, and death we see is definitely with increase in cases, deaths are not increasing at the same rate. It means there is no doubt there is some slight increase in cases of COVID-19, but there is hardly any hospitalization and deaths are not occurring. This disease being very, very mild. In India, if you can see, the maximum cases are being reported from Maharashtra. The more 35% of all the cases are reported by Maharashtra, followed by Kerala, and then Delhi. In the past 1 week, it means this is a previous data, the ending on from 1st to 7 June. ये देखें, ये previous week 1st to 7 and 15 June तक जो है 13 states have shown an increase in cases and 4 states have shown a decline. Largest decline was reported from Manipur, Arunachal Pradesh and Jharkhand. More than 100% increase in cases is now seen in 13 states: Maharashtra, Gujarat, Delhi, West Bengal, Punjab, Chhattisgarh, Andhra Pradesh, JNK, Assam, Ladakh, Sikkim, Meghalaya and Nagaland. If we see the other globally, United States, in the last 24 hours, they have reported almost new cases around 2 lakhs, and 7-day average of this week ending on 15th of June remains at almost 1 lakh. UK only 14,000 7-day average, and on 21st new case reported were 16,430. It means in UK cases are being controlled, but USA is taking a long time to control the disease. Germany also almost in the last 24 hours 1,19,000 cases has been reported, and Australia, you see, 32,895 in the last 24 hours. China, the mainland from where this COVID started, as per reports, only there are 133 cases in the last 24 hours. And South Africa, from where the Omicron was reported first, also showing the new cases the last 24 hours was only 0. Japan also now coming down, cases are coming down, and last 24 hours reported 15,367 cases only. Our neighboring countries, Bangladesh is still increasing definitely, but only 874 cases the last 24 hours. And 7-day average cases is only 524. Bhutan, new cases last 24 hours 0, and 7-day average only is 4. Pakistan also only 118 7-day average, 24 hours, last 24 hours no case was reported. Nepal is also very, very few cases, new cases reported 14. So situation is controlled in the neighboring countries. Regarding now monkeypox, as per WHO information, since 1st January, monkeypox cases have been reported to WHO from 42 member states. It means 42 countries have reported to WHO the cases of monkeypox. And total of, as on 15th June, 2,103 cases of laboratory confirmed cases of monkeypox have been reported with 1 death only. That's only only 1 case. If we see in the various regions, It is the European region of WHO which has shown the maximum number of cases. The other regions, African region of Americas, Eastern Mediterranean, and Western Pacific, a very, very small number. But maximum cases are from the European region, including UK. In India, so far, no confirmed case of monkeypox has been reported. This is all about COVID and monkeypox. Now I hand over to Chawla ji to invite Dr. Shruti. Today's topic is very, very important. Skin health is very, very important. Skin is not only the protection, it provides the first protection to our body and organs, but it's very, very important for your personality enhancement. Skin has a very big role. So detail will be now shared by Dr. Shruti. Back to Dr. Chawla.
Thank you, Dr. Kalra, for your nice words and update on COVID and monkeypox. For Shruti's information, Dr. Shruti, this is the HCFI platform. This Wednesday session was started by Dr. K.K. Agrawal to educate health educators. During COVID-19, we created a team of 1,000 health educators, those who used to help people in need. As you are aware, during COVID-19, there was a shortage of doctors. Doctors were not willing to help patients, not willing to see patients. Dr. K.K. Kalra and Dr. K.K. Agrawal, they decided to educate health educators and allow them to help people at large. And in case of emergencies where medicines were required, they were brought to our 24-hour OPD, where a lot of doctors like Dr. Anita Dhar and others were there, Dr. Anjali and Dr. Manish. There were so many doctors, they were working 24 hours. So you'll be addressing the HCFI platform, educating the health educators. Today's topic is new. During this entire 2 years, we have not been able to introduce any topic on skin. So for the first time, skin health is being discussed. And for the information of all, Dr. Shruti Kharbanda is a senior resident at Subharti Hospital. She is MBBS in medicine and surgery. She did her MD in dermatology, venereology, and leprosy from Jolly Grant Hospital and MD from Subharti Hospital. She has contributed a lot of articles in national and international publications. She has participated in various platforms as a speaker and as a participant. She did attend patients non-stop during COVID-19. Her hobbies include vocal music, harmonium. Next time she'll be doing something on harmonium also, and lawn tennis. So she'll be talking about skin health today. Welcome, Dr. Shruti, to HCFI platform, and it's over to you.
Thank you so much, Dr. Chawla, Dr. Kalra. I very much agree with you. There was a total deficiency of doctors during COVID, and all of us had to, step in and actually handle the entire burden of COVID on our nation. So, like a huge kudos to all the doctors who, participated in any way, because we all know how tough it has been for us, and how tough, not just physically, but also emotionally, being serving in this COVID pandemic. So talking about skin and health, skin का असर health पे बहुत ज़्यादा पड़ता है, और health का असर जो है skin पे बहुत ज़्यादा पड़ता है. जो skin है वो बाकी organs के तरह एक organ है. Body का सबसे बड़ा organ skin ही है. तो skin की देखभाल करना मतलब health की देखभाल करना, और health की देखभाल करना मतलब स्किन की देखभाल करना. जो स्किन का असर है वो हमारे साइकी पे भी पड़ता है, हमारे मेंटल स्टेट पे भी पड़ता है, एंड वाइस वर्सा द मेंटल स्टेट आल्सो हैज एन इन्फ्लुएंस ऑन स्किन. We see a lot of dermatopsychiatric disorders as well. So this just goes to tell us that skin is interrelated to everything in the body. Whatever chronic conditions also people have, जो भी conditions, जो भी health problems होते हैं, like BP, thyroid problems, you have diabetes, everything basically has an effect on the skin, and we as doctors can see certain signs. As dermatologists, हम certain signs देखते हैं skin पे, जिससे हमें पता चल जाता है कि अंदर body में क्या हो रहा है. तो आज मैं बताना चाहूंगी आपको कि स्किन की ओवरऑल हेल्थ को हम कैसे इम्प्रूव कर सकते हैं. एक तरीके का प्रिवेंटिव मेडिसिन बताऊंगी. प्रिवेंटिव मेडिसिन स्किन में बहुत जरूरी है, क्योंकि इसमें फिर आगे अगर डिजीजेस डेवलप हो जाती है, स्किन की डिजीजेस, तो वो ट्रीट करना बहुत मुश्किल हो जाता है, बहुत टाइम लगता है, महीने लग जाते हैं, सालों लग जाते हैं. तो इसलिए प्रिवेंटिव मेडिसिन बहुत जरूरी है हमारे लिए, स्पेशली स्किन में. तो हम स्किन के हेल्थ को कैसे इम्प्रूव कर सकते हैं? If I can have
start the Sapna, share the presentation, Sapna, please. Yes, we can see the slides. Dr. Shruti, we can see the slides.
Yeah. All right. Okay. If we can just play it. Okay. Can you the next slide?
This is the first slide, skin and
yeah. So the gut. So I always believe in this: कि our health, not just our skin health, but everything begins from our gut. What we eat. There are thousands of bacteria in our gut which have a huge role in immunity and auto-inflammation. So, and especially in COVID, we know that immunity is such an important thing for our body. So the gut that has your bacteria has a lot to do with your overall health, including skin health. तो जो तीन चीजें बोलते हैं, जिसको बिल्कुल ही नहीं मतलब बिल्कुल मॉडरेशन में या थोड़ा कम भी अगर हम ले तो अच्छी चीज है, क्योंकि ये बॉडी के लिए दीमक माने जाते हैं. फर्स्ट इज 3 whites. The first is flour, second is sugar, and third is salt. All are white. We should take all of this in moderation, or even less than moderation actually, because this just eats up the body from inside. So these are a few things that I believe that, for example, salt, जितना खाने में डाल रहा है उतना ठीक है, ऊपर से हमें और नहीं उसमें डालना चाहिए. बाकी शुगर तो बिल्कुल ही मिनिमल रखे तो ये अच्छी चीज है, क्योंकि शुगर जो है हमारे बॉडी में इंसुलिन रेजिस्टेंस बढ़ा देते हैं, और उसका कहीं ना कहीं स्किन पे और बाकी सारी हेल्थ पे इफेक्ट भी होता है. तो ये कुछ चीजें हैं, एंड कुछ चीजें ऐसे हैं जिससे हम अपने गट के हेल्थ को बढ़ा सकते हैं. फॉर एग्जाम्पल, अगर हम फर्मेंटेड खाना खाएं तो उससे जो अच्छे बैक्टीरिया है हमारे बॉडी में वो ज्यादा इम्प्रूव होते हैं, और उससे इम्यूनिटी, द बॉडी इज एबल टू फाइट अगेंस्ट ऑल सॉर्ट ऑफ इन्फेक्शंस, बॉडी इज एबल टू फाइट अगेंस्ट ऑल सॉर्ट ऑफ ऑटो इन्फ्लेमेटरी डिजीजेस. So having a good milieu, good ecosystem of bacteria inside our gut is very important, and how we can develop that is by eating fermented foods firstly. Secondly, we should ensure that we have local foods. Like if we're living in one particular area, we should have foods that are local to that area. We shouldn't, okay, we're living in North India, for example, and we're every day having South Indian food. That's not going to do so much benefit to us as it would do to somebody who's living over there. So obviously we should try everything, but mostly 60 to 70% of our food should be local. This is one more way in which we can improve our gut health. Another way in which we can improve our gut health is having seasonal food. For example, winters में हम winter का खाना खाएं, summers में हम summers के खाना खाएं. जैसे mangoes are a summer fruit, so we should have it right now. If you're having it in winter, it's not going to be so beneficial to the person. In a similar way, sarson ka saag and makki ki roti, if we have it in the summers, it's not going to be as beneficial as we have it in the as we would be having it in the winters. So these are a few ways in which we can increase our gut health. Baki, obviously, we should ensure that जो हमारा our plate should have different colors, different color की चीजें होनी चाहिए हमारे plate पे, ठीक है, इन सब चीजों से हमारी गट हेल्थ बढ़ती है, हमारा रिस्पॉन्स जो है बॉडी का टू इन्फेक्शन और टू इन्फ्लेमेटरी डिजीजेस दे इम्प्रूव, एंड दिस इज a huge part of preventive medicine according to me. इससे not only your skin health but your overall health improves, and overall well-being improves. If I can have the next slide. The second thing that is very important for skin health is exercising. Exercise in the form of any thing that would improve your, give a steady improvement to your health is very good. 20 minutes of exercise and yoga has been proposed on many platforms. If somebody just cannot exercise at all, at least 20 minutes a day is very, very important for the overall well-being of the person. So avoiding of smoking and alcohol is very important. There are so many skin diseases that arise due to these, and not just skin diseases, a lot of other diseases in the body as well. It totally it's the opposite of an antioxidant atmosphere inside our body, an antioxidant ecosystem or a milieu inside our body. So we need to totally give away with these things. Hydration, especially during this season, is so important. And hydration, not just in the form of just drinking gulps and gulps of water, that's not going to help. You need to have you need to have electrolytes along with it, so that the water gets imbibed in the body in the correct way. So having proper electrolytes, coconut water, or but that is very important, along with the 2 to 3 liters of water that we have. And we should always keep a reminder to ourselves about the water aspect, because if we don't remind ourselves, you usually don't tend to have that much water jitna we are required to have. Hydration is very important for the fullness of skin, and when you are hydrated, your skin also feels hydrated and fuller. The next important thing is sleep, because sleep, if you're having around 5 hours of sleep every day, that is going to age your skin drastically. And compared to, there has been a study, in fact, comparing two groups in which one group has 5 hours of sleep and one has around 8 hours of sleep. So those 3 extra hours of sleep is going to make a huge difference in your body and your skin. We should be aware of the fact that collagen, जो एक बहुत important चीज होती है हमारे skin में, जो skin के texture को अच्छा दिखाती है, तो वो जो है वो रात को सबसे ज्यादा बनता है. तो रात को collagen remodeling, collagen regeneration, ये सब night time पे ही होती है. तो इसलिए हमें around 7 to 8 hours of sleep every day हमें लेना चाहिए, so that this is also preventive aging. Aging obviously is going to happen to everybody, but in this way we can slow down the process. We don't want to accelerate the process. So if you're sleeping 5 hours, you would be like 10 years ahead of your age, and if you're sleeping around 8 hours, then you're like at your normal pace. So sleeping is very important because the collagen regeneration happens during night. So another thing is, do not apply over-the-counter medications. And a lot of people I've seen, especially where I work, over there, people are just applying over-the-counter medications which have steroid combinations, and that increases, increases the problems of the skin, and it causes increase in the fungal infections and so many other things. So over-the-counter products, creams, oils, ointments, gels are not, we don't recommend that. Get the proper treatment from a proper doctor if you're facing any sort of skin condition. जो बाहर शॉप्स पे जो ओवर द काउंटर ट्यूब्स मिलते हैं, क्रीम्स मिलते हैं, उसको ना ही यूज करें तो वो बेहतर है. अवॉइडिंग हार्श केमिकल्स, ये बहुत मुश्किल हो गया, स्पेशली कोविड एरा में. हमें बार बार जो डेटॉल, सैनिटाइजर, इन सब का इस्तेमाल करना पड़ता है. उससे हमारे स्किन पे रफनेस आ जाती है और इसको ट्रीट करना बहुत मुश्किल होता है. तो यही है, इसका सोल्यूशन यही है कि हैंड वॉश करने के बाद एक लाइट मॉइस्चराइजर को हमें अप्लाई कर देना चाहिए. तो उससे जो स्किन का जो बैरियर है, जो बहुत जरूरी है प्रोटेक्शन के लिए, वो इंटैक्ट रहता है। तो ये हम ध्यान रहे कि आफ्टर वॉशिंग के बाद हमें मॉइस्चराइजर का इस्तेमाल कर लेना चाहिए उसके तुरंत बाद। फेशियल मसाज एंड हेड मसाज से हमारा जो सर्कुलेशन है फेस का और स्किन का वो इम्प्रूव होता है, तो दिस इज ऑलवेज गुड टू गो। ये दिस ऑलवेज इम्प्रूव्स द सर्कुलेशन एंड ऑलवेज इम्प्रूव्स द टेक्सचर ऑफ द स्किन एंड कीप्स इट हेल्दी एंड अलाइव। एक नया टेक्निक जो बहुत ही हॉट टॉपिक बन रहा है आजकल, वो है डबल क्लेंजिंग। सिंगल क्लेंजिंग जो हम नॉर्मल करते हैं उससे इतना असर नहीं होता जितना डबल क्लेंजिंग से होता है। दिस डज नॉट मीन दैट यू क्लीन योर फेस ट्वाइस, दिस मीन्स दैट यू यूज 2 different cleansers whenever you're cleaning your face। मैं ये नहीं बोलूंगी कि बार बार हमें अपना फेस क्लीन करना चाहिए, पर जब भी हम करते हैं, फॉर एग्जाम्पल 2 times a day अगर करें वो भी ठीक है। तो एंड स्पेशली उन 2 times a day में 1 time रात को जरूर होना चाहिए। तो पहला हमें एक ऑयल बेस्ड क्लेंजर यूज कर लेना चाहिए जो कि सारा डर्ट या फिर कॉस्मेटिक्स हो गया या फिर जो भी हमने अप्लाई किया हो फेस पे वो सारा हटा दे पहले, क्योंकि वाटर बेस्ड क्लेंजर से वो नहीं हटेगा। फिर जो सेकंड है वो हमें वाटर बेस्ड क्लेंजर यूज करना चाहिए, और वो जो है वो हमारे डेप्थ में जाके, स्किन के डेप्थ को जाके उसको फिर क्लीन करेगा। सो डबल क्लेंजर ये तो बहुत ही आजकल हॉट टॉपिक हो गया है। एवरीवन इन द वर्ल्ड इज बीइंग अवेयर ऑफ दिस, सो एवरीवन हैज स्टार्टेड डूइंग दिस इन फैक्ट। सो डबल क्लेंजिंग इज अ वेरी गुड technique. I think it's a much more efficient technique, and you don't have to wash your face again and again and again throughout the day. Once or twice a day is fine, but the technique should be a little different. Double cleansing is the way to go in this. Next slide, please.
Next slide.
Next
slide.
Okay, a few other things that you can do to keep your skin healthy, which we won't probably are not so much, we won't keep that so much in mind, is like change of pillow covers, right, regularly. And your phone, nowadays we use our phones so much that we need to ensure that we are just cleaning it with a sterile swab or alcoholic swab, like at the end of after coming back home or something. Even it prevents from COVID and other things. So sterile cleaning of the phone, that can be very beneficial. Next slide. So I'll talk to you a little bit about the monsoon skincare. So firstly, we should avoid, now the monsoon season is coming on upon us, and we know that इसमें humidity बहुत ज़्यादा हो जाती है, उससे sebaceous glands का जो activity है वो ज़्यादा हो जाता है। तो हमें कुछ चीजें we have to keep in mind for our skincare. The first is to avoid the initial few parts of the rainy season, because that the initial rains have a high acidic component in it, and I've seen many patients having redness on this area when exposed to the initial part of the rain. And then is we should obviously use an oil stabilizing cleanser. Yahan pe we would give preference to oil control cleansers more, and for that you should visit your any doctor. I mean, like, not just over the counter. Get a proper cleanser, a mild cleanser for your skin. And you should definitely avoid makeup, because that clogs the pores and it would lead to retention inside. And even if you have to use makeup, which is totally fine if you want to use makeup once in a while, so in order for that, you should just use it for 2 to 3 hours and then just take it off. And how does one take off makeup? You don't just use towel, you don't use your towel or a tissue paper and just start rubbing your skin. You can do that via a simple using a micellar water. That is a very good substitute for makeup removal wipes. Micellar water is very easily available. That is very good for makeup removal. It does not damage the skin that much as compared to when we're using wipes. Then we have your sunscreen. This is the essence of skincare. Sunscreen needs to be worn in the morning. Even if it is a rainy season, we should wear the sunscreen, because the UV radiations, they would penetrate the clouds. Even then they can reach our skin, even during the rainy season when it's totally cloudy. So sunscreen, water resistant sunscreen is very important with an SPF of 35. इतना ज़्यादा फर्क नहीं पड़ता 35 and 50 SPF के difference से जितना हमें लगता है. It's just a marketing way of telling people to buy this SPF, but according to me, SPF 35 is good enough. It is the minimal SPF that is required. There's not much difference between an SPF 35 or an SPF 50 or 60 or whatever they claim on the product. So 35 is good enough. The only thing is you need to apply sunscreen every 3 to 4 hours a day, and not just when you're outside, when you're indoors also, because indoor lighting can also affect, for doctors, the OT lights, everything, all these can affect. Even the blue light that comes out from the screens and the laptops, they can all affect the skin. So we should wear sunscreen 3 to 4 hours the whole day, even when it is raining. We should wear it because we're not worried about anything else but the UV radiations that can penetrate through the clouds as well. So sunscreen is, again, like it should be worn. And the creams obviously should not be used from outside. The over-the-counter creams should not be used at all. And बस यही हमें ध्यान रखना है अपने स्किन केयर का कि एक चीज इसमें कंसिस्टेंट रहे कि हम बार बार इसको हम चेंज ना करें. We don't just go from one doctor to the other doctor to the third, because skin care requires a long time. It requires 6 to 8 months to actually show some sort of effect in the body. But one thing that is central to everything, no matter what age, is sunscreen. Sunscreen is of the central importance over here. Next slide, please. I'll talk to you a little bit about acne. Acne is a problem that is seen by so many people. Acne is not just, we think that it's because of dirt on the skin that we're getting acne. That's not, that is contributes to part of the pathogenesis, but not the full pathogenesis. Acne एक hormonal problem है usually. इसको हमें अगर treat करना है तो सबसे पहले ये ध्यान रहे कि एक कंसिस्टेंट रूटीन पे ही टिके रहे. इसका भी असर आने में बहुत टाइम लगता है. 6 months लगते हैं. पहले एक्ने को ट्रीट किया जाए, फिर उसके जो स्कार्स बच जाते हैं उसको ट्रीट किया जाए, तो इसका असर जो है 6 months एटलीस्ट लग जाते हैं पूरा वापस टेक्सचर वापस आने में, ग्लो आने में. तो उस सब के लिए हमें 6 to 8 months तो चाहिए. तो सबसे पहले पेशेंस इसमें रखना बहुत मुश्किल है कि वही चीज बार बार एवरी डे. तो कंसिस्टेंसी, पेशेंस, दैट इज वेरी इंपॉर्टेंट. एक्ने में हमें ये अपने डाइट का भी बहुत ध्यान रखना पड़ता है. हाई ग्लाइसेमिक इंडेक्स फूड, शुगर तो बिल्कुल ही ना ले, क्योंकि शुगर हार्मोनल लेवल को इन्फ्लुएंस करता है और वो जाके हमारे सेबेशियस ग्लैंड्स, जिसकी वजह से एक्ने आते हैं, उसको इन्फ्लुएंस करता है. स्मोकिंग अल्कोहल का बिल्कुल इस्तेमाल, स्मोकिंग अल्कोहल बिल्कुल ना करें. इसमें बालों में तेल अगर लगाना हो तो वो कम टाइम के लिए लगाएं. उससे हमेशा it always comes on the forehead, or it always does affect the acne and increases the acne. Then milk products should be kept to a minimal, because they also influence the hormonal level in some way. After you if you have a cause due to which you're developing acne, तो उस चीज को treat किया जाए. And बाकी you just have to stick to your routine, have your medicines, and also we have a lot of physical modalities जिसमें हम comedons जो हैं open pores को remove कर देते हैं, closed pores, open pores, उसमें जो keratin material develop हो जाता है उसको remove करते हैं. फिर आजकल peeling है और बहुत सारे procedures हैं, advanced procedures, जिससे हम इस चीज को जल्दी से ठीक कर सकते हैं. Next slide. So, like I told you, preventive medicine is very important. Preventive medicine, preventing aging. With this simple skincare routine, one can prevent the entire accelerated aging, and one can have a nice skin. Because once anything develops in the skin, चाहे वो infective condition हो, auto-inflammatory condition हो, या कोई भी normal cosmetic condition हो, तो वो बहुत time लगाता है treat होने में. तो इसलिए we should always be good to the skin, because it's going to be there with us, and it is the biggest organ of our body, and it is interrelated with every other organ of our body. That's all.
Thank you, Dr. Shruti. We have a question in the chat box. Just let me see. Any solution for birthmark removal from the face?
Okay. Birthmarks are usually resolved with lasers. there are not there's not much you can do. लेजर ही इसका एक तरीका है जाने का. आजकल तो बहुत अच्छे लेजर्स आ गए हैं जिससे पूरा ही ऑलमोस्ट चला जाता है डिपेंडिंग अपॉन द बर्थ मार्क. तो लेजर्स बहुत अच्छी चीज है आजकल. इसी से जाता है यूजली. अगर हमको टॉपिकल आपको सजेस्ट करेंगे डीपिगमेंटिंग एजेंट्स या फिर सनस्क्रीन, तो उससे बस ये है कि आपका जो है वो आगे बढ़ेगा नहीं, पर अगर पूरा हटाना हो तो उस चीज के लिए आप जरूरी है कि लेजर ही उस चीज के लिए किया जाए.
There is another question. Example of oil-based cleanser and water-based cleanser.
So oil-based cleansers, a mixture of I mentioned about oil control cleansers, so a mixture of glycolic acid and salicylic acid would do.
केशव जी, आप अनम्यूट कीजिए अपने आप को, केशव जी, और पूछिए अपना प्रश्न. यस केशव जी, गो अहेड.
नमस्ते डॉक्टर.
नमस्ते.
पाम में इचिंग होता है रेगुलर बेसिस में, उसका क्या समाधान है?
पाम में इचिंग अगर हो रहा है उसके बहुत सारे कॉजेस हो सकते हैं. मतलब ये कब से हो रही है आपको चीज?
ये तो जस्ट 1 महीना हुआ.
अच्छा, देखो उसका समाधान तो यही एक बार एग्जामिन करके देखना पड़ेगा. बाकी जो है अगर कोई स्किन कंडीशन, अगर कोई स्किन चीज दिख नहीं रही आपके, कोई लीजन दिख नहीं रहा आपकी स्किन पे, तो उसके बहुत सारे कारण हो सकते हैं. और टिकेरिया भी एक कारण है उसका.
अच्छा, कोई ऑइंटमेंट कुछ नहीं है, क्रीम ऑइंटमेंट देने से?
उस चीज के लिए मुझे थोड़ा एग्जामिन करना पड़ेगा.
अच्छा अच्छा,
जी.
ओके, थैंक यू.
नो प्रॉब्लम.
सोनल जी पूछ रही हैं, where can you get it, the cleanser?
You can get it after a prescription like from a doctor, or you can get it over the counter as well at any pharmaceutical store.
You रहेगा तो?
Okay.
Yeah.
Dr. Shruti, there is a question: skin care in neonates and babies. What do you say? Please.
Skin care in neonates and babies is very
I request everybody to keep yourself muted, please. Please mute करें अपने आप को. सबकी आवाज आ रही है, वो नहीं आनी चाहिए. Yes, Dr. Shruti, please. हाँ जी, बोलिए डॉक्टर श्रुति.
तो बेबीज में या न्यूनेट्स में पहले तो हमें ये देखना है कि ज्यादा हम बच्चे को नहलाएं ना, बहुत फ्रीक्वेंट बेदिंग ना करें उसकी. और जब उसको नहलाते हैं तो बस 5 या 10 मिनट के बीच में होना चाहिए उस जो कांटेक्ट टाइम है. ठीक है, उसके बाद एकदम से टॉवल से हमें पैक करके सुखा देना चाहिए, ऐसे रगड़ के नहीं. और इसके बाद हम एक मतलब या तो कोई इमोलिएंट या कोई लोशन लगाएं, ताकि ये बहुत जरूरी स्टेप है कि बाथ के बाद हम ये लगाएं. बाथ के दौरान हमें कोई लूफा या एक्सफोलिएंट इसका इस्तेमाल नहीं करना चाहिए. और जब एक बार नहलाना हो जाए तो फिर उसके बाद टॉवल में रख करके उस पे बेबी पे मॉइस्चराइजर या फिर कोई इमोलिएंट लगा के हम ऐसे ही, मतलब उसके थोड़े टाइम के बाद हमें वी शुड make the baby wear the clothes. Also, we should make sure that the baby's nails are very short and clean, very importantly.
Okay, Dr. Anita Dhar wants to ask. Yes, Dr. Anita.
First, let me thank Dr. Shruti for a wonderful lecture. And I always believe in prevention, and she has given very valuable tips for the prevention of how to prevent our skin and how to prevent to get other diseases. Dr. Shruti, I would like to ask, what is the role of, is there any role of retinol creams, which are in great demand nowadays? Is there really any role in role of retinols, regular use?
Yes. Retinols, I really believe in retinols. Night skin, it's a part of night skincare. So but the only thing to know in retinol is, again, it takes a lot of time to, it takes about 5 to 6 months to show results, but the results are really good if you, अगर हम उसको रोज अप्लाई करें फेस पे नाइट टाइम पे, क्योंकि वो नाइट टाइम पे ही हम रेटिनॉल्स और रेटिनोइक एसिड जो फैमिली है पूरी, उसको हम नाइट टाइम पे ही लगाते हैं. और यूजुअली अगर हम रेटिनॉल के ऊपर 1-2 घंटे के बाद एक मॉइस्चराइजर लगा ले तो वो उससे और ज्यादा अच्छा इफेक्ट आता है. तो रेटिनॉल्स बहुत अच्छी चीज है, और वो एंटी एजिंग, मतलब ये बेसिक बन गया है, मतलब एंटी एजिंग का। इसके बगैर कुछ इसके बगैर कोई स्किन केयर रूटीन कंप्लीट हो नहीं पाता है। तो इसको एवरी नाइट लगा लेना चाहिए। इट्स अ वेरी गुड थिंग।
Is
And you
it?
have to
Sorry,
night.
sorry. Carry on, carry on.
No, you were saying?
So, I was saying that I mean its best results would be if it started from the young age. What about if a lady like me, elderly lady, middle-aged lady, is there is any role of using retinol?
No, definitely there is a role. No matter what age, it causes a very good result. It gives a very good result, no matter what age you're using it. थोड़ा vigorously, थोड़ा ज़्यादा time लगेगा, बस ये है, but it definitely has results.
Okay, thank you very much.
Yeah. But sunscreen is essential. Sunscreen in the morning is essential. Retinols in the night.
Yep.
इकबाल जी पाकिस्तान से पूछ रहे हैं। इकबाल जी आप हैं यहाँ? इकबाल जी आर यू देयर? अनम्यूट कीजिए। हाँ जी बोलिए, पूछिए अपना प्रश्न, डायरेक्ट पूछिए। इकबाल जी पाकिस्तान से पूछ रहे हैं, बोलिए।
सर बेसिकली ट्रीटमेंट ऑप्शंस का पूछना था, सोरियासिस के बारे में।
सोरियासिस के बारे में,
सोरियासिस के बारे में ट्रीटमेंट ऑप्शंस।
अच्छा ठीक है। सोरियासिस एक मतलब वही क्रॉनिक डिजीज है, ऑटो इम्यून डिजीज है। तो इस चीज में हम टॉपिकल ट्रीटमेंट्स देते हैं, टॉपिकल कोल्टार, टॉपिकल विटामिन डी एनालॉग्स देते हैं, टॉपिकल स्टेरॉइड्स देते हैं, कैल्सिन्यूरिन इनहिबिटर्स। तो ये हम, और सैलिसिलिक एसिड, इन सब के कॉम्बिनेशंस मिला के हम देते हैं टॉपिकल ट्रीटमेंट। इसके अलावा हमारे सिस्टमिक ड्रग्स भी होते हैं जो हम देते हैं। उसके अलावा फोटोथेरेपी का भी रोल है। फोटोथेरेपी चेम्बर्स होते हैं, कोई भी डर्मेटोलॉजी क्लिनिक में वहाँ पे फोटोथेरेपी के चेम्बर्स होते हैं, तो उसका भी काफी अच्छा असर है।
So अभी senior citizens, they face a lot of skin problems. How should they take care of their skin?
So one thing that I've seen in senior citizens is senile purpura, जिसको बोलते हैं। तो जो वेसल्स होते हैं वो वीक हो जाते हैं, जिससे पर्प्यूरिक लीजन्स आ जाते हैं पूरे बॉडी पे। तो इस चीज में ये प्रिवेंटिव यही है कि हम विटामिन सी डाइट के थ्रू ज्यादा लें, विटामिन सी एंड सप्लीमेंट्स भी ले सकते हैं बाद में, पर विटामिन सी इज एसेंशियल इन दिस। बाकी इसमें सिरोसिस, जो कि ड्राइनेस ऑफ स्किन, वो बहुत ज्यादा दिखती है हमें सीनियर सिटीजन्स में। तो रेगुलर यूज ऑफ कोकोनट ऑयल और एनी इमोलिएंट और मॉइस्चराइजर, इसका काफी अच्छा असर आएगा। बाकी जो क्रॉनिक कंडीशंस होते हैं, कोई अंदर एटियोलॉजिकल कॉज अगर हमें मिल जाए, क्योंकि वो भी बहुत कॉमन है सीनियर सिटीजन्स में, क्रॉनिक कंडीशंस लाइक डायबिटीज और thyroid diseases or hypertension. So because of all of that, kidney diseases in specific, so because of all of that we see a lot of skin conditions. So if we can treat the cause कि कौन से organ में problem है, तो वो skin condition भी automatically treat हो जाता है।
क्या स्किन के ऊपर आने वाली जो स्किन आपसे बात करती है, स्किन आपको इंडिकेट करती है आपके इंटरनल प्रॉब्लम्स को, स्किन कहीं ना कहीं कम्युनिकेट करती है आपके साथ कि अब आपको कुछ प्रॉब्लम चल रही है अंदर?
हाँ, वो तो ऐसे हमें ऐसे ही सिखाया जाता है, ट्रेन किया जाता है कि कोई अगर पेशेंट आ रहा है तो हमें बस पता, स्किन को देख के हमें पता चल जाना चाहिए, स्किन को, नेल्स को, हेयर को, इन सब पे साइंस आ जाते हैं कि अंदर क्या प्रॉब्लम चल रही है।
और कोई किसी का क्वेश्चन हो तो you're welcome, otherwise we'll close this session.
It's really lovely talking about this and talking to all of you.
Thank you Dr. Shruti Kharbanda. We are grateful to you for sparing your valuable time for us, and we hope to see you again and again on this platform. Thank you also Dr. Anita Dhar, who has been a very senior health educator plus doctor. She has been guiding us, telling us, teaching us all the time. And Shruti also is, Dr. Anita Dhar introduced Shruti to this HCFI. I'm grateful to Dr. Anita Dhar, and I'm also thankful to Shruti Kharbanda. Next time, again, see you at the same time with the same, with a new topic and a new doctor. Same time, same channel, or same day, Wednesday. So please remember, see you next time. Next time is going to be our 111 session. Maybe we'll find some interesting things in it. Thank you very much. Hope to see you next week, same time. Same
Chawla
channel.
ji, young talent I have presented, na? Young,
Yes.
young
We
Yeah.
are introducing young people so that they
Young
could carry on the legacy of Dr. K.K. Agarwal for
Yeah.
a long time.
Thank you.
Thank you very much. Thank you all.
Thank
you.
Thank you.
Sapna, please
Thank you.
close live.
So you are enjoying in Seattle, huh?